I'm your host, Marcus Murray, and we'll be diving into how to submit an abstract for HPHA. So if you ever thought about submitting an abstract before, whether you're a student, a young health professional, or a seasoned public health professional, we'll be giving you tips. Today we have Dr. Rae Murray and Dr. George Smith, and together we'll be walking you through the process of how to submit an abstract. So before we get started, I'll let my guests introduce themselves. Dr. Murray.
Hi, I'm Linda Murray. I'm a retired Cook County Hospital physician and a specialist in environmental health. And I have the honor of being a past president of the American Public Health Association. Brother Smith?
Hi, thank you, Dr. Murray, and thank you, Marcus. My name is George Smith, Jr. I'm an assistant professor of public health at Chicago State University, and I've been involved with the American Public Health Association since 1999. I did a little involvement when I was getting my master's of public health, but I'm glad to be here with everyone so we can talk about how we can get knowledge out and how people can participate in our annual meeting.
Why is APHA such an important place to even submit an abstract or to be part of?
Well, first of all, public health as a field is so broad. And really, even if you don't have formal training or a degree in public health, it almost doesn't matter what area you work in. APHA is a place where you'll meet like-minded people, whether you're in a legal person, whether you're a social worker, whether you are doing reconstruction of highways. Almost every activity that we have has some impact on public health. But certainly, if you're a health professional of any type, this is an organization that's really the leading public health organization in the country. I know, well, I can be political. I'm retired. For example, in this present period that we're in with the new administration, APHA is one of the few national health organizations that are publicly speaking out and trying to defend the public's health and try to save us from this insanity that's going on. So it's an important organization to be active and part of. It's an excellent way to start your professional career by presenting at APHA, especially if you intend to go on and try to do publishing in the peer-reviewed literature. But even if you don't have that as a goal, just being able to meet with colleagues, present your ideas, and present your programs, it's a wonderful growth experience.
So, Dr. Smith, what role does abstracts play in the overall APHA conference?
It's very important because, as we know, we have to get knowledge out. So I teach a research methods course, and I tell the purpose of research is to increase knowledge. However, we in public health, we just don't do research to do research. We do research because we really want to focus on the outcome. How can we do something to prevent something? And as you know, in public health, we focus on primary care or primary prevention. Our goal is to prevent the disease. And so submitting an abstract is an opportunity for individuals, whether they're practitioners, whether they could be policy makers, they could be clinicians. It's a way to get information out so that we can make America healthy, because that's our goal. That's the goal of the American Public Health Association, is to make sure that we have policies, research, and other things that are in place that can make America healthy.
Excellent. One thing just to add too for people out there, especially the young people, if you're interested in a particular public health field, this is a good place to see people who are actually doing the work. It's a peer review process, and we'll get into that. So when you submit an abstract, there's peers, there's professional peers that review it to make sure everything's in line. But if you're in, let's say, Black Men's Health, and you go to APHA, you'll be looking at everybody specializes in Black men's health that has abstracts for that year. So you have a chance to meet the actual researchers, the professionals, and people from the community.
I want to say one other thing that's important. APHA has a career mart. So if you're trying to hire people, it has a career mart. But more importantly, for most of our audience, if you're looking for a job, it has a career mart. It's a national career mart. It actually runs all the time. But APHA actually, during the meeting, is an excellent time. And if you know about it ahead of time, if you sign up for it ahead of time, you can even have job interviews during the meeting. So there are lots of reasons to think about coming to APHA. So please, when you are planning your trip to the meeting, look for the Career Mart on the website. Well, what we want to do in this quickly, and we're going to be going through the slides. We hope the slides will be posted, is we want to be able to have you get some screenshots so you can see what's going on at the APHA. We want to explain the actual abstract submission process because that often confuses people. We want to review the rules and timeline for the abstraction, and we want to help you design an acceptable abstract. Next slide. So one of the things to remember, I won't read all the slides. This is on the website. A lot of the slides are screenshots of the website. So if you go into the website and just put down annual meeting, and it'll take you to how to submit a website. But anyone can submit. You don't have to be a student. You don't have to be in the School of Public Health. You could be in the School of Veterinary Medicine. You could be in pharmacy school. You could be in any number of places and submit. However, if you're accepted, the person who actually presents your paper has to be a member. But you don't have to be a member before then. Of course, if you are in healthcare, you should join APHA, definitely, and join the appropriate caucus while you're at it. Next slide. So here's our theme for this year. I see the slides a little covered up, making the public health a national priority. What they're basically saying is that especially, not because of, but especially since COVID, but even before COVID, the health of the nation has been going down. Life expectancy has been dropping. That's not a good thing. And the inequities between people's health has been getting wider. So our health as a country just has been getting worse. And so one of the things that we think in APHA is we need to make the health of everyone a priority. And so that's this year's theme. It's a broad theme, but to the extent you can tie your abstract to the theme, it helps you a great deal. Next slide. So now, George, you have been one of our leaders in the caucus in terms of reviewing abstracts. Marcus, I don't know if you've reviewed very many abstracts, but how often is the abstract that gets submitted connected to the actual theme?
It depends upon what the theme is. And so, for example, and Dr. Murray's talking about, I'm a member of the Black Caucus of Health Workers. And so we always try to encourage people to submit abstracts that focus on the theme, but we also encourage people to submit abstract, whether it's the Black Caucus, there are different other caucuses that may relate to a particular area of interest or a particular area of concern. So I'm just going to focus on, because I have the area of interest, particularly in Black men's health, as well as maternal and child health. So therefore, you may be an individual who's working with Black fathers and looking at how the role that Black fathers can play in children eating healthy. And you may have done that work. Submit an abstract to the Black Caucus of Health Workers, because that is something that definitely could get out and people could basically learn from that. That may not necessarily align with the national theme, because we realize, you know, we try to get people to come with the national themes, but sometimes there may be a public health issue or a public health interest that is not necessarily focusing on the current theme. But the one thing that we'll go in a little more details, as Dr. Murray and as well as Marcus will see, every caucus, and I'm talking caucuses, sections, and things that people may not be familiar with. The way the American public health is set up, we have something called sections. And then within the sections, it could be epidemiology, it could be maternal and child health, it could be vision, it could be oral health. And then we also have something called caucuses. The first caucus was organized, and we'll learn a little bit more about this towards the end of today's presentation, is the Black Caucus of Health Workers, which was organized in 1968. Our primary focus is to focus on the health of those who identify as Black and those within the African diaspora. And so we tend to focus on issues that relate to that, but there are other caucuses and things like that. This information is at the APHA website, and as Dr. Murray stated, please join, no matter what your interest is or how you identify. And one thing that I tell my students, there is no such thing as race. Race is your phenotype. It's a social construct. So however you identify or don't identify, there is a caucus, there may be a special interest group, or there may be a section in which you can participate. As long as you're a human, we love humans, go ahead and submit an abstract. And so again, as you see right here, the one thing that I will say is pay attention to the deadline. And so here's the thing. I understand life happens. I'm joining here today. I just recently got a new laptop, and so I was in Safari. Well, Safari may not work, or you may say Chrome. You want to have enough time to go in and submit. And right here, the deadline for most of all of the sections, caucuses, and we'll go a little bit further, other entities, is going to be March the 28th, which is a Friday. Please don't write now some people are really good. They can get up Friday morning at 6 a.m. and write that 250 word abstract and submit it by 12. God bless those people. I know I'm not one of them. I'm just not that good. For some of us, we may need a couple of weeks, even a month or so. So I would say, though it says March 28th, let's aim for March 27th. So that allows for your computer to crash, for your Wi-Fi to stop working. You never know what happens with your family. The dog can fall out. You got to take him to the vet. So again, that's just wanted to share that. And one other thing too, as we go to the next slide, is that you will get a notification from the American Public Health Association, and they will definitely let you know if you got accepted or not. But we also have some rules. And if you don't mind me, Dr. Murray, I'll cover a little bit of the rules. Is that okay?
Go right ahead. Go right ahead.
So one of the rules, as Dr. Murray has talked about, you do not have to be a member to submit an abstract. However, if your abstract is accepted, you must register for APHA, and it ideally would be in your best interest to join as a member. Now, this is not to coerce you, but this is just a reality of working with nonprofit organizations. And if no matter what your profession is, there's always some fees associated with being a member of a national organization. Once you are accepted, COVID-19, thank God, is endemic. However, they will have requirements. And again, if you have to have an exception or something, that's something you can take up with APHA and give you the most recent information. The one other thing right here is that if you're coming, you will have an opportunity. If we go to the next slide, I'm just going to sort of
no, that's good. Go ahead.
Yeah. Is that if you're coming, we will send you a notice, and it will come from APHA. So please check your emails. That's something very important. Please check your emails. Whatever email you use to submit your abstract is the email in which you will get communications to. And so sometimes, let's just say you submit an abstract to the Black Caucus of Health Workers, and I'm one of the program planners. We have other individuals. You won't get an email from me saying that your abstract has been accepted. You will get an email from the American Public Health Association. So always check around it's around June 5th, give or take, or June 3rd, when those letters come out. Check your spam, and check your email, and make sure you can always reach out to the section that you submitted, but you also can reach out to the American Public Health Association. They will have a number and an email address on their webpage. Now, this is something that we just have to be realistic. If you fail to show up without notice, we have to, that may affect you presenting further. We understand life happens. We understand the climate that we're in now. There have been, this past year, I noticed that some people had personal illness in their family and they could not attend. I understand that. Sometimes funding does not come in. We think we have the funding's not there, and you're not able to attend. What we ask is that as soon as you find out that you cannot attend, please email your section. Please email APHA as well as the section, the caucus, or the SPIG that you submitted your abstract to. And this is something right here. Some people are really great and they can present multiple times, but at APHA, it's a lot of other people that are great. So we're asking that you limit yourself to 3 abstracts. And here's the thing that's really important. 3 distinct abstracts that are talking about 3 different things. Dr. Murray, and Marcus, we're on the right pathway, right?
Right.
So it can't be something, this is part of my research. This is part of my research. This is part of my research. You're probably saying, what do you mean by that? We all have a research agenda or developing one, but it has to be something that's distinct because we want an opportunity for everyone to have an opportunity to present. And also too, and you'll learn APHA, we only have so much time, and you could actually get scheduled at the same time. Or you may not have time to run, and APH is large. You're thinking you're going to present in a room next door. That could not be the case depending where you located. It could be a 10-minute walk or a 20-minute walk to get in between. But really, just limit yourself. Let's be realistic. sometimes it's hard just to get one abstract done, but the goal of APHA is to limit that to 3.
Absolutely. And please remember, once you get an abstract or poster, whether it's for oral presentation or a poster, we'll get to that in a minute, accepted, this is something you can put on your CV, on your resume for jobs. So that's important. So don't forget that. I want to remind people who are students, there is a discounted student rate. As long as you're taking at least 6 credit hours as an undergraduate student. If you're a graduate student, you only need 3 credit hours, but you do need to have your school certified. It doesn't have to be a school of public health. It could be a different kind of school, a different discipline, and you'll be able to get that discounted rate. And also, if you just graduated within a year, there's also a special discount for early professionals. So don't let that frighten you. But I want to say, and we can go on to the next slide.
There's also a special rate for professionals that make under, I think, 55,000.
Right.
The rate for them as well.
That's absolutely right. So I put question marks here because there is a student assembly, but I didn't update that slide. So as Dr. Smith said, you can apply to your section. If you are a public health person, you should be paying dues and you should have a section in addition to whatever else you're doing, whether it's health administration, whether it's social work, whether it's nursing. That's going to be your major section. Or you could be involved in caucuses and SPIGs. For example, there's a men's health caucus, there's a men's caucus, there's a women's caucus, there's a Latino caucus, there's a socialist caucus. So this is to remind you, it's on the website. APHA is not paying for any trips. So this is not where you get accepted and they pay your way. That maybe when you get so famous that you're one of our keynotes in the opening session, they may pay your way. But in general, no, we don't. They're not paying your way. And this is a difficult time. So let me just talk about this now. This is really part of your career. This is like a secret thing that they don't tell you. Obviously it's not required that you belong to APHA, but if you're going to function in any profession, you need to be active in that profession. And for public health people, there are lots of organizations, even though I'm biased toward APHA, there are lots of organizations that you could be involved in. So you should consider this part of an investment in your career. And this is a difficult time with a new White House and a new administration. So the most expensive part of any professional trip is usually the hotel. Okay, you can be diligent and get some cheap flights. You can, the actual cost of going to the conference, you can save up for. So you should start doing that now. It's February, but this is DC. Do you have any friends? Do you have any colleagues? Is there a bed and breakfast? So start strategizing about that now. Again, the hotel is the most difficult, the most expensive. Next slide.
Dr. Murray, one thing that I would share about that too, if you are a student and you get accepted, sometimes some colleges and universities have travel funds. So anyone who is a student, please reach out to your dean of student services or such. I can't say, but some schools may have travel funds for students who particularly have an abstract that has been accepted. So that's just another avenue to look at as well.
That's true, and workplaces are too. I'm just being pessimistic with the change
Correct.
in political atmosphere. But if you have an abstract accepted in most workplaces and schools, you're at the top of the list for whatever money they do have. They'll give it to someone who has an abstract accepted. So I just have this slide up here. It's a screenshot we're going to go through some other screenshots. When you first get on the website and it says, are you ready to submit your abstract? You're going to push submit. Now you're going to be able to come back to it 2 or 3 times and save it. But we're going to give you this information. So hopefully you don't have to do that too often. So this is an important thing, especially if you're submitting more than one abstract, but even if one, you're going to get right away. You're going to know what email you use to get on, and you're going to get an abstract ID number. You need to write that down, because if you submit it and you do what Dr. Smith said, you don't wait to the last minute, you may want to go back and check it. You may want to go back and add some information. So don't lose that abstract ID number. Write it down somewhere, put it in your phone where you cannot use it. So that's important, because that is how the APHA is going to keep track of you. And if you have a question, that's how you're going to touch base. Next slide. Now, there's some things, of course, in the professions that they don't really write down. Every section, we're going to look at the Black Caucus today, but every section and group has their own little unwritten rules. So you may be doing something on teenagers who are pregnant for the first time, and that's possible to present in a number of different places. If the teenagers you're interested in are Puerto Rican, you may be able to present at the Latino caucus. There's a maternal and child health section that you could present in. Depending on what you're looking at, if you're doing something, for example, that may be related to nurses or nursing visits, you could present at the nursing section. You could present at the women's caucus. So most papers could be presented in a number of different components. And so it's important for you, before you decide where you're going to submit your abstract, to just click through and read each component, because everybody has a different little flavor to what they want. They may have different formats in terms of what they're willing to accept. So pay attention to that, because whatever you do, you want to follow those instructions. So you can think about that. Next slide. So this is just a look at the website. You're going to go in, and you're going to go to the section that you're interested in. So there's a whole bunch of sections and SPIDs here. You can see the Committee on Women's Rights, alcohol and tobacco. I just took the slide. It reminds you when the deadline is. You click on that. We're going to pretend we're clicking on Black Caucus and go to the next slide. Okay. So again, you want to pick. It makes sense to pick a component that you actually know something about. Maybe you've been to some of their sessions, so you have an idea of what kind of stuff they like, whether it's a caucus or a section or whatever. And you're going to log into your APHA account. You're not going to have one of those unless you're a member, but somebody that's going to present has to be a member. So you have to, have an account. It's easy to set one up, and you log into it. Next slide. So this is the Black Caucus of Health Workers. We're going to go in a little history in a little minute, but this is just looking at the top part. This is not everything that's on the website this year. It reminds you the theme. It reminds you when the submission deadline is. Different sections may have slightly different deadlines, and they may change over time. So keep an eye on that. But right now, most of them are saying March 28th. It gives you a little background, and it highlights the topics that component is interested in. So you might have an epidemiology section that might have different bullet points, So looking at this is important as you think about where's the best way to present your paper. I'll say this though, I'm not saying it's the only place, but the Black Caucus, for example, you notice that bullet, faith and spirituality, that's almost always in the Black Caucus's thing. So if you're doing some work and you're looking at the role of faith and spirituality, even if it's not about Black people, you might find a home there. So looking at those bullet points becomes important. We often have a session around faith and spirituality, right, Dr. Smith?
We do. And so we do. And as Dr. Murray has alluded to, we will collaborate sometimes, and we'll talk a little bit more. Sometimes, depending upon how a person submits, they may submit something and I may say, hey, this doesn't work. Not necessarily doesn't work, but this may work better in another section, or this may work in another caucus. And sometimes we are able to share that with others. And so I would definitely say, as Dr. Murray said, look at the bullets. We're focusing on the Black Caucus of Health Workers. And so therefore, and there might be some overlap. For example, environmental justice and health. That's not necessarily just limited to African Americans, but it also can affect those who identify as Latino, those who are those who may be involved with it. We have an international global health caucus, environmental justice and health. There's an environmental section. There's an epidemiology section. There's a maternal and child health section that may have some environmental factors. So as Dr. Murray has alluded to, pay attention to the bullets. Most of the times, most of the bullets will align with your research. But if you go to a particular section or you go to a particular caucus and that bullet isn't there, I would say maybe not submit. And the reason why I said maybe not submit is that may not be a priority for that particular section or that caucus. And so you do have to do a little bit of homework and a little bit of background to see where does your research best fit. Would you agree with me, Dr. Murray and Marcus?
Absolutely, absolutely. And always, if you go to your section meetings, if you go to your caucus meetings, if you have a concern or a problem, you can always ask someone. And if you call Dr. Smith, he might say, well, the women's caucus might be interested in that. Next slide. So this slide is a useful thing. Every section doesn't have all of these types of sessions, but I want to go through this. There's a status, I think, of incorrect status, but there's a status to the sessions. So the highest status in a professional scientific meeting is what they call an oral presentation. Oral session. But I don't agree with that. But let me just, so usually at the most you only have 10 minutes. So don't think you're going to go in there and be able to give a half an hour presentation. You have 10 minutes, and often you're booked with other people. You might have 3 or 4 or 5 people in 10-minute sessions. And even though it has the most prestige, it's the least fun, in my personal opinion. Sometimes a session will have a panel discussion that are organized a little differently. And at least with the panel, even though you may only present for 10 minutes, there's usually some discussion between presenters and with the audience. That's much more fun than just the 10 minutes. The poster session is always underrated. I think this is, for me personally, this is the most fun if I have to present. I think you learn a lot from it, and it's very different. So in the poster session, you make a poster, and as you know, you have it at 2 o'clock on a certain day. You stand in a line with a lot of other posters, maybe 100 or 150 other posters. But what happens there is people are walking up and down the aisles. They stop at the posters that they think are interesting. And you have discussions with people that come along that are interested in what your poster is about because they stopped. And so you really can have a different kind of conversation. A lot of times you'll meet people that say, oh, I was doing a study similar to that in Texas. You're able to exchange business cards and the like. So I really think the poster sessions are the most fun. I don't know, what's been in your experience, Marcus, with the poster sessions?
Well, I have nothing against poster sessions, but I like standing on that soapbox. So the oral presentations is what I like. And I remember when they used to be like 13 to 15 minutes. But yeah, oral presentations, I like them both. It's just I have nothing against the posters. It's just my style. I like to talk.
Okay. The round table is a little different. Again, different sections do different things. With round tables, traditionally what happens is you're at a table, maybe you're describing a program you worked on or an educational intervention for quitting smoking or something like that. And people come to your table. So there'll be a small group of people that you're talking to, and you have more of a discussion. And again, usually in these round table discussions, they may ring a bell every 15 minutes or so, and people switch tables. So that's a lot of fun. It's like a round robin kind of thing. So anyway, there are these different possibilities. We're today going to be focusing on the abstract, writing an abstract. Next slide. So this is what it looks like in the beginning when you start off. That red arrow is pointing to the abstract number. That's how you're going to find your presentation again. But you can see here, this is a screenshot. There's a place to write a title. Next slide. We don't have to spend a lot of time on these. Next slide. I just want you to know what it looks like. So you're going to be marching through this screens, and so it's helpful to know what's coming up. This is an important slide here where it says oral only, oral preferred, poster only. My advice is put no preference. Okay, that's my advice. What happens with the people who are making this this program is it depends on what city we're in and how much room we have. There's some years where there are not enough rooms to accommodate all the great abstracts and all the good discussions that need to go on. So if you only put oral only, you'll miss the chance of doing a poster, which again, even if that's your preference is oral. So I would put no preference. It gives you a chance to present something. But obviously you don't have to choose that. Next slide. This is the same thing. And this is not a session on how to do a poster. I encourage you to go on YouTube or someplace because there is an art to doing a poster, but we don't have time for that right now. Next slide. So again, you're going to march through this. It doesn't matter what you put here, but don't skip any sections. Take your time and march through it. So this is just asking you to select learning areas. This is not all of them. So be thoughtful, and it says here you can select up to 6. This helps people categorize what sessions to go to, etc. So don't skip anything. Don't skip any part. Next slide. And ask for some more information, whether you are have any industry affiliation, whether you're using any products, like if you're doing a study of the impact of a certain medication. Off-label means it's not the official FDA way to use it. So you have to fill that out. And lastly, don't forget to communicate with organizers if you can, if you have information that you want to know. I know in the past, I know Project Brotherhood has organized some sessions around men's health, and they want to communicate. How'd you communicate to the organizers that you wanted certain papers together, Marcus? Or George, either one.
So you would go into as Dr. Murray said, to the comments to the organizers. So one thing that you could do is say, hey, I'm doing research in Chicago on men's health. And this is another researcher. They're submitting a paper. Our work is kind of related. Maybe we could come together, or maybe we could try to be in the same session if that allows. Also, comments to the organizers. This is also just a good place to put in, and I say extra, that you are a student. Because sometimes, there are certain, like, for example, the Black Caucus of Health Workers, we'll learn a little bit more. We have a special session that's dedicated to students. And sometimes when you are putting in your information, people may forget to say that they're a student. But you could say right here, hey, I am a MPH student at blank university, and I'm really interested in this being reviewed for the Dr. Paul B. Corneli student roundtable. And so those are other comments that you can put in that you just think is relevant. The one thing that I always tell my students is be P and C. Be precise and concise. So therefore, and we're going to get to talking about the abstract of word limitations, but just put in any pertinent information that you think that the reviewers could utilize, but also we have program planners, should your abstract get accepted, that we could take in consideration.
And just to answer your question, Dr. Murray, Project Brotherhood was in a very unique position because we might have had several projects, several grants going at the same time with different universities around different topics. So we might be dealing with one university on colorectal cancer, another university on lung cancer. So when we submit those abstracts, they're going on simultaneously, concurrently at the same time. So it's easier for us to present to a certain caucus and say, hey, we're working on these 3-4 projects. And then once we follow the guidelines of APHA, we were lucky enough to get those abstracts accepted, and we were given a full session. So it's rare, but it does happen. It just depends on time and the work you do and everything else, and where you submit and how you submit.
Absolutely. Next slide. So this is the Black Caucus, but this is a standard abstract format. You should look at it, and you're going to follow that format with exactly the headings that they have there: background, methodology, results, conclusions. That's a standard sort of template for abstracts. Next slide. But the Black Caucus and most of our caucuses have an alternative format, as they point out here. This is if you're doing a special policy, or maybe you're trying to present a training that you did. I know Project Brotherhood had a citizen scientist program that they were doing. So those things they don't quite fit into that straitjacket format. And so this is describing another thing that you want to do. Maybe you're trying to discuss the loss of the Dobbs decision, which doesn't allow women to get abortions and restricts reproductive health. So you may be having a discussion about, well, what can we do about this, losing this basic right? And this alternate format allows you to submit an abstract. But as it says, you have to say the issue. You want to describe the thing clearly. You still only have 250 words. So you want to outline for the reviewers what that presentation is going to cover.
I think that's one of the hardest parts, though, Doc, is the 250 words. Trying to get your thoughts across in 250 words is not an easy task. So let me ask you this, Dr. Smith. In your years of reviewing, have there been some common mistakes people have made with submitting their abstracts?
Sure, I would say definitely pay attention to the word requirement, and so that's number one. And I always try to, as I tell my students, I always in my classes and at many universities, we write in APA, which stands for the American Public Health, the American Psychiatric Association writing format. And they say that a abstract has to be 250 words, because 250 words, you have to be precise and concise to say, what are you doing? It's not your total presentation. You're just giving us a summary of what you did. So I would say definitely pay attention to the word limitation, but this is something too. Pay attention to your grammar and typos. And so I'm not an editor, but let's just all be honest. If you see a lot of typos, any of us, or errors in a sentence or in a paragraph, we can accept one or two, but if it's every other sentence, what do? We start defaulting to the errors and the typos versus to the content. This is something that I tell my students, and there's nothing wrong with this depending upon what institution that you're at. It's a wonderful thing out there called Grammarly. It doesn't hurt to, after you've done your abstract, to and we use it's double checking the spelling. We all make mistakes. Who writes a perfect paper? Hence, if we had there is no such thing as a perfect writer, because if we had perfect writers, we wouldn't have editors. And so therefore, everybody makes a mistake. So I would suggest submitting it to Grammarly, using Grammarly if you can. If not, submit it to one of your colleagues, said, hey, look this over. I've had students that submitted in the past, and they would say, hey, Dr. Smith. Now, of course, they couldn't do it last minute, but they would, you can reach out to your instructors and say, hey, this is my abstract. What are some of your thoughts? So I would just say learning how to write an abstract is just like going to the gym to be a bodybuilder. It's going to take more than one time. You don't go to Planet Fitness and show up at 8 o'clock, and by 10 o'clock, you got 10% body fat, and you walk out Hulk. It requires doing some work. And so you have time now, and as Dr. Murray has said, and as Marcus has said, take a little time now. Maybe you spend 20 minutes today just coming up with your thoughts. Then you spend 20 minutes more. Maybe you get it to 300 words. And then you say, I'm at 300 words. Let me see how I can take some words, because it is difficult, because if it was that easy, everybody would do it. But just say, let me get it down to at least 248 or 240, so that when you submit it to someone else, they may say, hey, this is not clear. Put a little bit more here. So I would just say it's definitely time conscious, but I will say this: it is not a solo effort. I would say that it's not what I mean by solo is, don't think you're going to do the research, or if you have research or a policy and it's just you and you don't involve anybody else. Because I don't know, Dr. Murray, maybe you can speak to it. I don't know how you don't do research and you're a solo researcher. I don't know if that's
right. It doesn't happen. And we're gonna, next slide, Dre. We're gonna give you some actual concrete tips later on. I want to do this slide. We're going to talk about the Cornelli Roundtable for Graduate Students. Again, this happens to be the segment for the Black Caucus for graduate students. So if you're a student, take advantage of this. And let me be clear, just because you're in that student section, these are excellent papers. So don't in any way feel like you're being restricted. But I wanted to now I'm going to take a little commercial. This is going to be a commercial.
Doc, I think you need to say that again. Just because you submit as a student doesn't mean your work, your abstract is less than those people that are professionals. Everybody is judged on the same level. They don't lower standards or higher standards based on your based on whether you're in school or employed.
Absolutely. But if you're smart, or I should say old professional like me, I always pay attention to the student sections, because they're the ones with the new new software and new stuff. But anyway, we're honoring Dr. Cornelli here, and I'm going to do a quick, I won't spend a lot of time, but I'm going to do a quick commercial is February, Black History Month. So we're going to go through a little quick Black history, and then we'll get back to the details of writing an abstract. Next slide. So Dr. Corneli was born in 1906. You can see here he's born in Guadalupe in the Caribbean. And in 1920, his family moved to Detroit. Next slide. So he was in Michigan. He received his bachelor's and his MD, medical doctor from the University of Michigan. You can see in those years. And in 1934, Dr. Paul Corneli becomes the first Black person in the United States of America to receive a doctorate in public health. So he's an important person in our history for many reasons. Next slide. He then moves to DC and joins the Howard University College of Medicine faculty. In 42, he becomes the chair of the Department of Bacteriology and Preventive Medicine and Public Health. And by the 47, he served as the medical director for Freedman's Hospital. This is the oldest surviving Black hospital in the country. It was established during Reconstruction as part of the Freedmen's Bureau, and it's the teaching hospital for Howard Medical School. Next slide. Dr. Corneli he really was an important researcher in a number of ways. He really planned a series of conferences in the 50s about how to deal with segregated hospitals. And in 1963, a lot of people don't know this, during the famous March on Washington, he coordinated the medical support for that giant march on Washington. Next slide. This is the height of the civil rights movement in the 60s, and racism was alive and well then as now. And so in 1967, I think it was 67, Black members of APHA walked out of the opening session because they were unhappy with the response of APHA toward civil rights. And in 1968, Dr. Corneli and others formed the Black Caucus that we're talking about today. In 1970, he's elected as the first Black person to be president of the American Public Health Association. And a couple of years later, he received the highest award that we give in APHA, the Cedric Medal. So he really was an important person. I had the privilege of seeing him whenever we went to DC for a number of years before he passed. He lived well into his 90s. And he really is a leader within not only APHA, he's also a leader within the National Medical Association, the Association of Black Doctors, of which I'm also a proud member. Next slide. So submit an abstract for this section named in his honor, and do him proud, honor our ancestors. Next slide. So let's get back to this. We had a slide about this already. So you're gonna pick your learning areas and things. This helps people find you in the abstract. If I'm looking for, I want to see who's doing work around HIV in young women. This is the kind of thing that helps you find them. Next slide. And this is an effort to again talk about certain health indicators. Next slide. So you can just pick those. Now comes the important part. This takes a little bit of work. When people come to this meeting, yes, they want to see people, they want to see their old friends, they want to go to interesting sessions, but they also, a number of them, need to get continuing education credits. All the three of us are in Illinois, so people in Illinois, if you're a social worker, if you're a licensed social worker in Illinois, you have to get so many continuing education credits a year. If you're a physician, a pharmacist, a dentist, a nurse, you'll know in your area if you have to get continuing education credits. And APHA is able to offer a lot of those credits. You can sign up for them when you register. Usually it costs a little money to get credit for that, but that's important. And in order for your session to be able to offer credit, you have to have clear learning objectives. And when you go through the APHA schedule, you'll see some sessions are blank, you don't get any credit. And some sessions will get you credit. So for me as a physician, when I go to APHA, I look right away for what sessions are going to give me continuing medical education credit, because I'm paying money to go, and that is important for my license. So don't skip this section. It's important. It draws people to your session because they can get that professional credit that they need. And so we're going to talk about how you do that. You have to write learning objectives, and APHA helps you on the website. But as it says there in sort of orange or whatever that color is, you're looking for certain verbs, and there's a list of them there that you have to use to write your learning objectives. Next slide. So don't skip this important part. Pay attention to it. Take some time to do it. You may have to write it 2 or 3 times. You have to have at least one, but 2 or 3 is probably a good number.
And that's correct, Dr. Murray. And one thing too, in the reviewing process, if you don't have learning objectives, your abstract will get reviewed, may get a lower score. So literally, as Dr. Murray is saying, you have to have at least one learning objective. And if you have, say you forgot and you had 0, well, we have to review them. And so therefore that might be, I don't want to use the term a ding, but that might be something in which may be held against you because, as you stated, we have to have learning objectives.
And you shouldn't feel bad about it because it helps you focus what you want to talk about. But you think of it this way. Don't think of it as a formal course issue. Think of it like, what is it do I want my audience to get out of what I'm saying? Okay? That's really what you're saying. So it helps you focus your message that you're trying to put on. And you can see, next slide. You can see this again. This is from the website, but you can see that area in the box. It gives you some hints. It says the outcomes must begin. And I'll tell you, if you don't begin with that word, the computer won't let you go on. But I want to analyze the COVID rates that different communities in Chicago had in 2020. Okay. I want people to compare the impact of understanding cancer, whether you're a man or a woman. So you use all these words, define, demonstrate. These language keywords are how you start, for APHA at least, those learning objectives. Next slide. And if you get confused, you can go on YouTube. The computer makes it so easy. There's a whole bunch of stuff on how to write these. It's just a slide from them. There are tiers on. You're presenting in just a few minutes. So, you don't have to you're not going to do 7 of these. In 10 minutes, you're not going to have 10 learning objectives, right? So you just need 1 or 2 at least. Probably no more than 3, I would say, as a basic rule. So this next one is, again, now this is what trips people up, especially if you're filling this out at midnight the day before, okay? Because usually when you present, you have to be clear who's going to be doing the presentation. And then you have to include everyone else. And that might be 5 or 6 other people. And you need all this information on all these people. You need their name, their real name. You can't say Junior. You need as we say, their white man's name. You need their legal name to put up in here. Whatever credentials they have, legal credentials, their email address, okay? And you have room for an alternative email address. But anyway, you need to have their email address. So these are 7 or 8 people. You need to know whether they're a member or not. There are other things you may need their phone number, So get that basic information, the next slide, about all the people that you're adding. They want you to know if there's any accessibility problems and issues. Are they a student, etc.? What university they're in, if they're a student. So you may need this information for all your presenters. So what happens? How often do people do this? Do they fill it out completely, or what happens?
So they do. Usually the ones that have a little red dot are required, but as Dr. Murray has stated, and as we go a little bit further, is that make sure you get as much information as you possibly can prior to submitting. But definitely name, email address is definitely the information that you have to have. And it'll have a little red dot. And if you don't put that information in there, it will definitely, the system won't let you go forward. And if we can go to the next slide, because we do know that we get so excited about this information. So this right here, if you need to add somebody, you can just go ahead and add a new person. But this is something that is very important. Everyone whose name is listed on that particular abstract has to complete a conflict of interest form. So if you have 3 people, there needs to be 3 conflict of interest. And what a conflict of interest is, it is just a form saying that you just letting us know if there's a conflict. For example, say you are working on the effectiveness of a drug that can combat diabetes. Fine, that's really great. We know that we have an epidemic of diabetes. Well, if it was funded by a pharmacy company, you have to say, hey, or you work for this pharmacy company. So it's just a statement, and it's not it doesn't mean that you did anything wrong. If you have a conflict, you state what your conflict is. If there is not a conflict, you just basically say no conflict. And the majority of people, and I would say this, Dr. Murray and his Marcus, is that the majority of people don't have a conflict of interest. And so, but that's definitely something that you must complete.
Absolutely.
And if we go to the next slide. So
So
one thing.
Oh, go ahead.
So this is one thing too right here that is very important, and it says right here. So you're required to disclosure, and then you have to give a statement of why we should consider you as a qualified to be someone who submits an abstract. And so you could say, for example, and you don't have to, people may not be and have an academic career, but let's just say you've worked with people who have substance use disorders. You can say, I have worked in the field of substance use disorders for the past 7 years. I have a complete understanding working with those environments, with those individuals, particularly who are unhoused and live in urban areas. And therefore, so just giving a brief description of why you should be able to submit an abstract. It is not your resume, it is not your curriculum vitae, but just giving a little information about why we should consider, and we mean being APHA and reviewers, that you are a content expert. So
Absolutely.
That's just.
And what you don't need to put here are your degrees. They're not
Correct.
asking what degree you have. They're saying, like, what makes you think you know anything about this? This is an example we were following through with Dr. Williamson here, was submitting some article on colonial stuff in the United States. So she said, I spent 70 years as a colonized person. You can say, I spent 20 years working with people who are addicted to drugs, or, so it's not, this shouldn't be a barrier to you. Just say in plain English why you know about this stuff. But again, don't just put down MPH, DRPH. That's not the reason why you're going to present on the specific slide. So again, you want to list all the authors. There's a summary for you. You can come back to it next slide. So just remember, it's telling you what you need to know to have ahead of time. Next slide. You'll get this email back or something like it from APHA. So Dr. Williamson, who is now older than 70, but anyway, so her paper in theory on the effects of racism and colonialism and white supremacy has been accepted. And so when that happens, you need to let everybody know. Next slide. So this is something that Dr. Smith was talking about earlier. The first thing you need to do after you look at this, is write the 250 abstracts, and then write it again. And then you should really write it at least 4 or 5 times before you submit it. Gather up everybody's information that you need ahead of time before you start messing with the website. Have that ready ahead of time. And again, at least probably 4 drafts at least to get your 250-word essay. And Dr. Smith admitted the day before. I think you should try to submit at least 3 days before the deadline. Because if you, like me, and live in the hood, half the time the internet goes out, you don't want to be stressed like that, So there's nothing wrong with submitting it a couple of weeks early, but certainly at least 3 days before, because you have to worry about your internet and you have to worry about APHA's internet. You know what's going to happen, right? The day of the deadline, everybody's going to be flooding the APHA website trying to get their submissions in. So don't make things stressful for you.
Question, Dr. Smith, Dr. Murray. If I submit my abstract, let's say 2 weeks prior to the deadline, and I want to add something else, am I allowed to go back in and play with it and make changes before the actual deadline?
Yes.
You can, yes.
I can add a potential author or potential second, third objective. All right.
Yes.
So everybody, if you heard that, when you submit, you can make changes up until the deadline of your caucus. And
right.
Look at that date.
So I'm sorry, go ahead.
Dr. Smith, and you're reviewing and just dealing with a lot of abstracts for the caucus. when it comes to titles of your abstract, is there anything that sticks out? Are there things that you paid attention to? Does that make a difference?
I would not necessarily say titles. What I would say, and I'm going to sort of put it in this premise: does it make sense? And can I understand it?
Yeah, I actually have a slide on titles coming up. Let's go to the next slide, please. We talked about why it's important. Next slide. So again, this is important to keep in mind. In the abstract, you want to say what you did, why you did it, how you did it, what you found, and what it means. So that's 5 sentences. It may take more than 5. So that's what you want to do. Go on, and it's going to go back to that one slide. I'm sorry. So this helps you with the format usually. So those questions fit in certain areas. Next slide. So again, Georgia said this, you want to be complete, concise, clear, cohesive. That's why you want to keep going. Next slide. A winning title does help. Okay. So you don't have to make it like a commercial, but you have a little fun with the title. Because again, you're going there. There's literally thousands of sessions. And on any given moment and any given day, there might be literally 4, 5, 6 different sessions that you're interested in easily. And so something with a catchy title, Cancer in the Hood, may resonate with some people, okay? So,
well, I will say this. Now, I don't know if it makes a difference in terms of being reviewed. Like, Dr. Smith spoke on that. I reviewed. It didn't really bother me. I did it 1 year. But in terms of being reviewed, I don't know if it makes a difference. In terms of standing out as a presenter at APHA and getting people to come to your session, I think the title makes a huge difference. For years, Project Brotherhood has always used titles that speaks to the population of people that we serve, Black men. So you were here doing good in the hood, followed by some type of cancer project or something like that. Why is that important to us? Because we want young people to see what we're doing. And we know sometimes we get up there, we're academics, people are professionals. They get up there and they start making these long ass titles that we don't even understand ourselves as health professionals. So,
right. So,
there's a transition between trying to get an A in college and using certain words and getting people to see your work in a professional sense,
Correct.
Right.
Right.
Let's go to we can still talk, but let's go to the next slide.
We following your lead.
Okay. Right? So these next couple of slides, it helps you. You want people to get motivated. When they read your abstract, you want them to get excited. So you want to know, why should they come? Why did you care? Why do you care? Family, so many Black men die from prostate cancer. You need to capture people. What problem are you trying to solve? Next slide. What method you used? We interviewed people, we did focus groups, whatever you did, so that people have an idea of what's going on, and what results did you get? Now, when I say results, it doesn't mean like this is how we cure prostate cancer. It may be we learned Black men's attitude toward prostate cancer or something, something like that. It doesn't mean you like have an answer per se, but be specific about what your results were. The next slide. And then you want to say something about what you found. Is it important?
Make sure it makes sense. Back to the precise and concise. Make sure it makes sense and that it reads well. And one thing that I've learned I have to be very careful of is I call it the alpha. We call it acronyms of the alphabet soup. You don't want to have, the GGT did the ABC, did the DFG, and the HIT didn't know about the GED. And so it's kind of like, what are you talking about? And so right here, just take your time and again, look at these things that we say right here. In the next slide, I think this was definitely covered that.
Yeah, go back 1 minute.
Okay.
All these do not pay attention. Have somebody, if you are in have somebody that's a friend of yours that don't know nothing about what you do, read the abstract. And if they can't understand what the hell you're talking about, then you need to change it. Don't, this is not the beginning of a paper. Don't say, as Dr. So-and-so showed in 1907. Don't do that. That's in an article. critical. This is the abstract. It's the shortest thing. Don't include references if you have any doubt about that. Next slide. Active voice is a useful thing, and there's an example there. Rather than saying 15 patients with AIDS were studied, just saying we studied 15 patients with AIDS. So that's an active voice. Try to use an active voice in your abstract. That'll help you. And try to write only one thought per sentence. Now, this is not how you write a paper or anything. This is how you write an abstract. So you don't want to make complicated sentences with different clauses in it. Try to have one thought per one sentence, and you'll work on eliminating unnecessary words and making sure that the grammar is correct. Next slide. Follow the instructions. Use the headings exactly as they say. Check, even if you don't have Grammarly, they still grammar check and spell check on Word or whatever else you can use. So pay attention to that and do that. Next slide. And then this is critical at every point. Read your abstract aloud. If you can read it to somebody else, because as you read aloud, even you'll catch mistakes or catch things that don't make sense and things you could cut out. Next slide. We're almost at our last slide here. We don't have to spend a lot of time. Once your abstract is accepted, don't just sit back. Okay, you got to keep working on what you're doing. You got to get your slides together for your presentation. You got to find out where the hell your session is. If you're giving a paper Tuesday afternoon, don't arrive by plane on Tuesday morning. Okay, if you can possibly avoid that, you want to be there early. If your session is in XYZ building, ideally the day before your presentation, or at least the morning, if you're having an afternoon session, go to where you're supposed to be so you don't waste time getting lost trying to find where you're supposed to do the presentation.
Yes,
okay?
That's very important. 95% of the time, Project Brotherhood, we walk the day before. We know all our presentations are. Last year, I take responsibility. I did not do it, and I was in the wrong floor. I might have been in the wrong building, looking at different numbers. So for real, be prepared. Check it out. If you get accepted for a poster session and you're traveling, what airline are you going to use? Because it makes a difference when you carry those posters. Are you going to ship it to a hotel or ship it to a UPS store as opposed to Airbnb? All these things make a difference, especially when you're trying to invest into yourself. And I would add, when you present, tell some stories. People there are professionals. We're academics, so we understand certain things. You don't need to break down the social determinants of health to us when you're presenting, unless it has to deal directly with some outcome, some objective that you're presenting on. So a lot of times when we get places, I'll give you an example from Project Brotherhood. We tell our young brothers, nobody knows what you did. Nobody knows what you know. Share it with them. Sometimes you want to hear what it's like to organize a focus group. They want to hear what it's like when you engage men to get them to talk about participating in some type of clinical trial, whether it's blood, a survey, or just their vocal opinion. Those stories, those anecdotes are the things that we're missing. Those are the things that people want to see. Yes, they want to see, I'm not an epi cat. I'm trying to think of some epi BS. Yes, they want to see the data and how you did it in red cap and, the power. They care about that because it's the results. But the thing is, there's like-minded people and they want to know what you did. Sometimes sharing an interaction or sharing a form you used or sharing the number of times that you reached out to men, which is still a way for metrics and collect data, is just as important as that health behavior model you used and things of that nature, some of the scientific stuff. So some of the best way I could say is some of the soft qualitative stuff that we do in research can be highlighted and will be accepted. Don't think your research always has to be quantitative and with numbers.
Absolutely. And assume things are going to be messed up. So even though you're going to upload your presentation electronically, which means you should be able to call it up, put your presentation on a thumb drive and bring it with you. And just as importantly, print your presentation out. Because if all the computer system goes down, you still only got 10 minutes. But if all the stuff goes down, you can give an engaging talk from your printed slides and printed presentation. So come with a printed copy of what you wanted to say and as well as having it on a thumb drive. Though hopefully everything will work and you won't have to go to those extremes, but it's better to have them. And this is the last slide coming up here. The next slide is the last slide. So remember, look into the career mart, and if something happens, either you're not ready to submit an abstract or you submitted an abstract and didn't get accepted, volunteer in your section or caucus to moderate a session. Volunteer to review abstracts. That's an excellent way to improve your abstract writing skill, is if you volunteer to review abstracts. And remember, this is an investment. It's just as important as your investment in your degree, because having just the letters after your name without experience and connections isn't going to get you anywhere. So pay attention when you go to your professional meetings, whatever they are. Become active in the session and your caucuses, and then you can help shape the program that comes up in the future.
Go check it out. See what you're getting into. Sit back, listen, learn, and you'll be able to do it. So before we leave, can you tell us a little bit about the Black Caucus?
We have a website, bchw1968.org. So again, you can search us on the internet, Black Caucus of Health Workers. We are the oldest caucus of the American Public Health Association, formed in November of 1968 in Detroit, Michigan. Our purpose is to ensure that any public health issue that is related to Africans living in the Americas and even worldwide is at the forefront of the American Public Health Association. Several of our members have gone on to serve as national presidents of the American Public Health Association. Our little heart right here, Dr. Rae Murray, is a member of the Black Caucus of Health Workers and is a former president of APHA. So what I would like to end in this note is that please visit our website, bchw1968.org, and I will hope to see some students at APHA in Washington. I'm never too busy to talk to a student. So if you see me walking, I may be walking fast, you walk with me and we can talk. So I look forward. I want people to submit these abstracts, and I just can't wait. I'm excited.
Doc Murray, you got anything to add?
We got to get out here. Abstracts are the least of what we need to be doing. We in trouble as a country. We got to be writing abstracts, talking at APHA, talking on the street corners. We need to be everywhere talking, because our people's health is in danger.
It's not the end of the world. We survive much worse. We'll be all right. Thanks for tuning in to how to submit an abstract. This is part 1. When it gets closer to APHA, hopefully Dr. Smith and Dr. Murray will be back. And we'll go into a more in-depth talk about how to navigate APHA. And we might have some people on that got an abstract accepted, because navigating APHA and writing abstracts are 2 different things. Again, we want to thank young health professionals, the great Chicago State University. You know we love CSU, baby. Dr. Linda Murray, Illinois AHAC, and of course, Project Brotherhood. So we'll see you soon. And of course, my main man, Dre. Thanks for helping us out, Dre, all the time, Jack.